Hi, I'm Rob Ward, and I'm a family physician from Richmond, Kentucky. And this is my, I think it marks my 30th year in family practice. And I work with complementary and alternative products in my work, what's called functional medicine. In January, I learned about Asea. And what happened was my paradigm shifted. My medical model just had to shift because what I was seeing happen with my patients was that they were able to create a balance in their body that I'd never had seen, nor had I seen anything that would allow that to occur. So the science that I discovered has to do with what's called Asea. And Asea is a redox signaling technology that is new. It is the sort of the category creator of this science, and what was thought to be impossible a few years ago is now possible, to put reactive molecules, these little amazing redox signaling molecules, into a stable form that allows our body to consume them and then create balance. The balance has to do with two components. It has to do with inside the cell reductants that stabilize and activate our antioxidants. The antioxidant molecules in our cells are taking care of oxidative stress. So when they have the sort of the, you can think of it like turning a light bulb on, when they light up with the balance from these little molecules, they're able to help our cells deal with the stresses of day-to-day life and the problems that our degenerative conditions create. Additionally, there's another balanced component in Asea. They're called reductant molecules, and the oxidant molecules. And these molecules help to direct and improve the intelligence of our immune system so that it's reaching its full potential. And this helps us deal with conditions that our body would be so reactive towards, such as problems with our immune system, where it might be overreacting to things in our environment, or perhaps where it's kind of focused on attacking itself, which can happen with many medical conditions. So this technology has, as I said earlier, shifted my paradigm. And as a result of this, when I, over the years you work with people, you get to know them, and you have to answer questions. People will say, well, okay, so what's the next step, or what's going to happen next with my problems? And it's not fun to tell people, okay, this is the general course of things, and that's the best we have in medicine. That's the best we have in our toolbox. Well, today I've got a new tool. Asea is a new tool, and it has changed the equation so much that frequently I have the hair on my arm just kind of stand up with amazement at what people have been able to solve. And I have a patient who's in her 80s. She visits with all the various special doctors you can think of, from heart doctors to lung doctors to endocrinology doctors, and the list. She takes a long list of medications from each of those physicians, and I, being her primary care doctor, kind of try to pull the whole thing together. She has oxygen, she has a wheelchair that she primarily stayed in, and a few months ago she said, is there anything more we could be doing? And I said, well, there might be. This thing called Asea. Let me have you take a look at it. She liked what she saw. She kind of looked at a little web broadcast thing, and so she said, I'd like to try it. Within a week she called and said, this is just astonishing. All my days are good days. I don't have bad days. And for anybody who lives with chronic medical problems, there's good and bad days. Now she's going to church. Her friends say, Ada, what are you doing? What's going on? You look great. She says, I'm drinking Dr. Ward's water. And, they say, well, how do we get some? I don't know. But she's making her own breakfast. She's using the wheelchair only to get from long places to long places. And she's seeing her body restore itself. And it's just exciting. So even people who have very serious problems can find benefits. So my patients who have athletic interests are seeing improved recovery and better ventilatory capacity. And people, so there's one side of the spectrum. I have infants who have red rashes who we spray Asea on and they get better. Very safe and simple. You know, this product has no toxicity. This product has no way to interact with any drug or with any disease. It's working with our body. It's not absorbed or assimilated by an organ. It's just absorbed by our body very naturally, just by diffusion. So it's completely safe. And as a physician, I love that. So it's good to be able to share with you, and we'll look forward to seeing you in the future. Take care.